Hey, this is Doug Field, CEO of the Institute for Healthcare Consumerism, along with my co-host Brent Macy, Managing Director. And welcome back to the segment, Healthcare Consumerism Radio. A lot of change in this market, like we were talking about earlier on the previous segment, Brent, around health management. And one of the leaders in the space is on the phone with us today, and they've made some interesting moves. And joining us today to really talk about what's happening within StayWell in the health management space is Trent Sterling, CEO. Hey, Trent, good morning.
Good morning, guys. Thanks for having me, and thanks for your interest in StayWell.
Yeah, good to talk to you again. We haven't seen each other in a couple of years, so good to have you on the phone, and a lot of changes there. I mean, tell our audience, I think a lot of our audience knows the moving parts. They know Krames StayWell. They know StayWell Health Management. Give us an update on what you guys have done in around reorganization and what you see as the future of the marketplace.
Sure. Well, the market's evolving rapidly, as everyone knows. There's so much going on with reform, with different payment structures and incentives going on out in the market, and we really see the traditional silos that exist in the market. The lines between those silos are blurring. The lines between employers and health plans and hospitals and health systems and physician groups and the emergence of ACOs. And so we've been a player in all those verticals for many years, and this merger really is a recognition of the fact that our solutions are well suited to span across a variety of these silos. So we're creating one organization called StayWell, and it will be able to span across all of these areas of healthcare and really bring a unified point of view around consumer health engagement. And we think our years of history in the space and our deep penetration into all these different markets position us well to pull this off.
You know, it's interesting, Trent. I don't know whether you could join us on the first segment that we had, but I was at a Hero think tank meeting where kind of your co-partner Dave Anderson was there, and we were at a presentation yesterday with Ron Leopold, who got a pretty good history in this space, and we talk about it all the time that there was a concern at one point in time that health management was going to take a backseat with the evolution of private exchanges and some of these other things, but we see just the opposite. It's a very important part of what employers need to be doing, and it just requires a little different positioning, and I think what you guys are doing is saying the same thing, correct?
That's right. That's right. It's really been amazing, and you mentioned the employer space. What's amazing to us is we're working with thousands of hospital clients as well, and several hundred health plans, and when we're out talking to these organizations about their needs and the needs of their patients and members, it's just very rewarding to hear about the appetite that these organizations have around health and wellness in behavior change, in health management, in a way that's really different from how they've traditionally been thinking about it. You mentioned David Anderson. He and I are working very closely on this merger, and what's energizing for us is thinking about how do we take some of the behavioral science and the behavior change expertise and the evaluation and measurement capabilities that really have been focused in the employer-oriented population health management space. How do we take those ingredients and weave them into patient education and other types of consumer health engagement in a way that really brings the whole engagement with consumers around healthcare topics to a whole new level. And it's energizing, and we think it's an exciting time to be in this space.
Yeah, a lot of times. Go ahead. I'm sorry, Trent. I apologize.
Well, no, I was just going to say our Krames business, our StayWell Health Management business, these businesses were pioneers in their respective areas of patient education and worksite health promotion. And so we've lived through multiple generations of interest or lack of interest in these various categories. And so we see it all coming together now, and we think the future is very bright.
It's interesting, Trent. I was dating myself when David Anderson and I were talking that when David and John Tarbuck and I met way back in the day when StayWell was a control data company. So I just dated myself and gave you pretty good history there. So,
you are dating yourself. That's going way back.
Yeah, it is.
And now, Trent, this is Brent. When through this merger, what you guys have over 2,000 clients. What's your product offerings going to look like going out to those clients that you currently have following this merger?
Right. Well, we have our product line, as you can imagine, have been built over the years, very focused on the vertical. So we've got a full suite of solutions that we sell to each of our core markets. Within the markets we play in, what unites everything we do is united under kind of an umbrella of health engagement. But when you get inside of organizations, a health plan or a hospital system, we have solutions that address member and patient acquisition and retention, more for marketing departments of those organizations. We have a suite of products around education and training, which generally is focused obviously more on the clinician, the clinical folks within those organizations, and then we have population health management solutions. And so, and we have within each of those pillars, if you will, we have a wide assortment of digital solutions, print solutions, phone-based, live coaching-based solutions. And so we will preserve those legacy solutions that are matching up very nicely with the markets that we've served traditionally. What we'll be doing differently as part of this merger is taking some of the pockets of expertise that exist in these pillars and really exporting them across the entire business. I mentioned working closely with David and his colleagues from StayWell Health Management and figuring out the right way to take behavioral science approaches to behavior change and really enhancing the patient education experience. That's something that this merger allows us to do. Health systems are very interested in this as they think about patients more as health consumers, as individuals and families for whom they're responsible for really managing their health over time in kind of a longitudinal way. And so we'll be taking some of these deep pockets of expertise and infusing the other aspects of our business in a way that really wasn't possible before. The other thing that is exciting is it creates more critical mass for us. So from a developmental point of view, we can take expertise and just do more faster. And both organizations, being legacy organizations, one of the challenges is you're always needing to innovate and stay ahead of the curve. And so we believe as an organization that's very committed to innovation and development and the use of cutting-edge technologies, there's just lots of efficiency in doing it jointly. And so you'll see an acceleration of the pace in our ability to innovate.
Yeah, it's very exciting. Thanks. When you hear me particularly talk about employers, Trent, I talk about them a lot, not just as a channel, but as, they are more and more the influencers back to their health systems, back to their hospital systems than they've ever been. I don't know whether you're seeing the same thing. We see it every day.
Yeah, definitely. And, one of the things that employers have been so good at over the years, I think most people on the employer side would hope they could even do better, but it's in this area of engagement.
Yep.
And the way...
kind of the hot word right now, isn't it?
It is. I mean, and we use it. It's probably overused, but it's the only word that really captures what this is all about, because a lot of these programs that we've developed, that others have developed, we know they work. We know that if you can get individuals participating, that their health status will improve and their lives will become better, or they'll be better patients, or they'll have fewer readmissions, or whatever. We know the programs work. It's just about getting individuals to introduce these things into their busy lives and stay involved, stay engaged. And the employer market has really done the pioneering work in that space. And the rest of the health industry has a lot to learn from the great work around incentives, around social engagement, and various other ways of promoting these programs and evaluating and measuring and rewarding. So we're excited to learn and export all these great things that the employer market has brought to the space and feed this, what seems to be an insatiable appetite by health systems and health plans also to get in this game and understand this space and leverage these capabilities.
Trent, we see a lot of convergence going on with on-site clinics and data analytics and health management. What are you doing in that space right now, or are you looking at, some things to do in that space?
We have a long history in on-site health promotion, and we have a lot of experience and interest in doing that. When you said analytics, it just got me thinking about, everyone is so focused on infrastructure and analytics, which is fabulous because we need to understand the needs and we need to get the right programs and messages to the right individuals. But one of the things that we believe there's a shortage of are programs and solutions that actually can kind of get the last mile and do so effectively. So working with those that are on the ground closest to the patients, as well as using analytics to do the matching between programs and individuals, we believe we're well suited to just drop exactly the right program using the right media, whether it's web, mobile, or print, and give those frontline people better access to a variety of tools.
Hey, Trent, I appreciate everything. Time flies when we're having fun. You got about 30 seconds to go, and I want you to be able to leave our audience with a key takeaway or two, please.
Well, thank you. One of the things that's exciting to us is the opportunity to impact individuals' lives. And we believe we're involved in very important work. We're very passionate about helping individuals live healthier, happy lives. And so we believe by bringing these capabilities together, we'll help our clients, employers, health plans, health systems, reach their consumers and their patients and their employees more effectively and help them accomplish their missions ultimately. So we're excited about the future, and we appreciate the great work you guys are doing to promote it.
Yeah, thanks, Trent. I appreciate it. Hey, come down and join us in Atlanta at IHC Forum and Expo and May 7th and 9th. It'd be great to see you down there, and hope you can join us.
Great. Thank you. I'll look into that. And, again, thanks for the opportunity.
All right, everybody. Thanks, Trent. Have a great weekend, and stay tuned for the next segment of Healthcare Consumerism Radio.